MEOR.
Yeah.
Should sharing medicine be a thing?
Wow, okay. You took a totally different route there
what a nice
with the word
segue.
of sharing. Yeah, that's actually one of the things that a lot of people may take things for granted. You know, like you visit a clinic, you get a certain amount of medication, and then obviously you tend to consume it because you're supposed to consume the medicine, but then somehow or other you think that you can easily share it with your families or your friends or whatnot. The thing is that we want to debunk right now. Is it actually safe? Is it even permitted for anyone out there to be sharing the medication that is supposed to be just for you, Nabil?
I don't know, but I remember if you think about real life cases at home, like sometimes I do think that paracetamols can be shared among family members.
Or cough medicine maybe?
Or cough medicine. But when I mentioned something about that, I do remember that my sister is allergic to paracetamol.
Okay.
So it wouldn't be a good idea for her to share the fever medicine that I'm taking.
Yeah.
But sometimes the lines do get a bit blurred, like what are your allergies, what are your personal symptoms, they do differ for one individual to another. Hence why
we have an expert in-house who's going to be sharing her insights on this topic. The topic mentioned is about sharing medications. As it say, we have NURUL ELIFA Muhammad ZAINI, pharmacist from TANGLIN Health Clinic, Kuala Lumpur. ELIFA, thank you so much for coming. Happy Sunday.
Happy Sunday.
Okay, how was your CNY? Okay, was it awesome? Was it good?
It was awesome.
It was awesome.
Even though I do not celebrate it.
No. We are Malaysians. We celebrate every single thing.
Everything.
Everything. Right? Okay.
Yeah, I do.
So do you celebrate with a lot of medicines? No, I'm kidding.
What?
So yeah,
right, jumping to the first question at hand, because again, at first thought, again, what I've mentioned is, and what Nabi has actually mentioned as well, when it comes to sharing medicine, is it actually that safe to actually share medication as simple as that? Or is there some guidelines that everyone need to be aware of when it comes to sharing medications, or just giving out medication to someone else?
Okay. Actually, for us pharmacy, and also we always tell patients that we follow the 5R concept.
5R, okay.
5R, yes. What is 5R? Okay, 5R, the first one is right patient, and then right medicine, right doses, right route of administration, and also right time of administration. So for example, for the right patient, if a medicine was meant for patient A, it's only for patient A. It should not be shared with anyone else. And next is right medicine. For example, for medicine that is meant for diabetes treatment, the medicine should only use for diabetes treatment. You cannot take diabetes treatment to treat your cough or to treat your flu. And then next is right dose. So for example, if the dose is being recommended by the doctor or pharmacist, you should take as it is. You cannot self-estimate the dose. Okay, and then right route of administration. For example, if the medicine is advised to be taken as a whole to swallow, then you should swallow. You cannot crush or you cannot chew. And then lastly is right time of administration. There are certain medicine that we advise to be taken at certain time. For example, to be taken at night. So we as a patient, we have to follow. Okay, so sharing medicine, some people think that they want to share medicine because they want to save money, but actually you cannot do that because it goes against the concept of 5R. It goes against the concept of right patient because if the medicine is suitable for one person, it doesn't necessarily suitable for the next person because one medicine might be useful for one, but might be harmful for another person. Yeah.
Similar case to what Nabi has just mentioned, the fact that his sister is actually allergic to paracetamol, even though it's a common type of medication, it could be dangerous to some people right now.
Yes, correct.
But I mean, sometimes I would say that those allergies can sometimes be an abnormality. It could be a rare case.
Yeah, small percentage perhaps.
Yes, so what about people who have the same symptoms? Like, for example, maybe both of them are coughing and they want to share the same cough medicine. I mean, it doesn't sound necessarily too bad. What about those cases?
Okay, for those cases, okay, for example, and two individuals presenting the same symptoms like fever, but we cannot simply determine that, okay, for fever, we just simply give antibiotic for both condition. No, because for fever, bacterial infection, fever can be caused by bacterial or viral infection. So for these two conditions, the treatment of course, it might be different.
Okay.
So, and of course, the doctor will evaluate the patient because every treatment is individualized. It is not general. So the doctor have to examine the patient first and then have to interview the patient whether he is taking other medicine or not, or if the person have any drug allergy or not. So we want to avoid these things.
Yeah. Speaking about antibiotics, as you mentioned earlier, ELIFA, is that I think I'm right in saying this, that antibiotics, you have to finish the dosage of whatever it is that's been given to you.
Yes.
Let's say like you have a dosage of, you need to eat it twice a day for a day, for a time of 5 days or whatever it is. Like it or not, you kind of like have to finish it because it is very, very critical in your, to beat the virus or beat the bacteria that you're fighting against. So should you actually share that antibiotic? That doesn't even really make sense because that means that you're not finishing in the first place, right?
Yeah, correct. And then actually for patients who do not finish their antibiotic, it's actually a very big pet peeve for us pharmacists and also doctors, because we strongly advise patients to finish their course antibiotic. For example, for children, they will get antibiotic syrup. So for antibiotic syrup, we won't give exact amount, ml, because we will always give extra. So we will advise patient to complete the duration of the treatment, for example, for 7 days. And of course, after 7 days, there will be extra of antibiotic. After that, we will advise the patient, if you have extra, you should discard the antibiotic. You cannot keep it, you cannot use it for your other children, because it's very dangerous. We want to avoid antibiotic resistance. Antibiotic resistance is a condition where the body develop resistance. The antibiotic cannot work anymore. They cannot inhibit the growth of the bacteria, or they cannot kill the bacteria anymore. So that is very dangerous. That's why we always emphasize to finish the antibiotic. You cannot share the antibiotic. You cannot keep the antibiotic. Okay, I think after 3 days I feel healthy already. I don't want to finish. You have to complete the course.
But sometimes there are numerous factors that come into play.
Okay, you sound like a very stubborn patient here.
Yes, I want to share my medicine. I want her to say that it's okay. No. Of course, it's not okay. I want to delve deeper into the reasons behind it. Sometimes people want to save money.
Sure.
We mentioned that earlier, and then sometimes it is just out of negligence and ignorance. They feel it's okay to not finish their medicine, or they feel it's okay to use the same medicines that the siblings use. Oh, same parents, maybe you could have the same genetics, we're okay. Something like that.
Could be.
Yes, such things. Okay.
So macam what would be your advice? Like macam sometimes kids do not know this. Like how would you raise the awareness to kids about how are we not supposed to share medicines?
Yeah. I mean, it all falls down to the parents' responsibility, isn't it?
Yeah. For children, for the pediatric. For example, if their children having simple illness like fever, cough or flu, and the parents feel like they want to buy medicine from the pharmacy, the over-the-counter medicine. So it is okay, provided that the parents know the exact dose for their children. Because for pediatric, for children who are below 12 years old, the dose for the dose of medicine are based on their age and also their body weight. Yes. So the parents must know the exact dose for their each and every children. Because of course, for siblings, they have different age, they have different body weight. So the parents must know the exact dose for their children, and also. As I mentioned earlier, they cannot self-estimate the dose. They should ask the pharmacist first. If after self-treatment doesn't work, then we will advise the patient to go and see the doctor.
Yeah, because I mean, like speaking for experience, whenever I go to the pharmacy to buy medication for my son or my daughter previously, they always ask like, okay, how old is your kid? What's their weight and whatnot? So because they would literally come up with a calculator and calculate using a certain formula, right?
Yeah.
What is specified for that particular child according to the age and weight. But having said that as well, because, and also me being the easy kind of guy, more often or not, we just like read something off the internet and from this reputable sources and whatnot, saying that you just take this and you can share it around. How truthful is that? Obviously that must have been another pet peeve for you. Where patients are self-medicating because they think that whatever they read online is all correct.
Yeah, I don't know, because Malaysians, they tend to believe the testimony, and then they tend to believe everything that they read on the Google. Yeah, WhatsApp, sharing forward everything. And then my mom also forward this thing. Is it correct? This one cannot lah. Actually, if you are unsure, especially about medicine, you should and you always have to ask. You seek for advice from your pharmacist or from your doctor, because medicine is not something simple. It can lead to harm if you unsure about it, and then you just say, okay, yang ini okay, of course akan okay. It's not because same medicine might give different action to different individuals.
But honestly, I mean, if there's a bottle of cough syrup in my fridge right now, and Nabil is coughing, can I just give it to him? It's cough syrup anyway. It's being sold over the counter, right?
Okay, you can if you know the exact dose for him. If you are very sure.
He's a big boy, isn't he?
Yeah, we're around the same age.
We're around there, but is it really that harmful, or what would your advice be on that? Because again, we're not talking about any specific kind of medication. We're talking about generic kind of thing. Again, paracetamol, cough syrup, flu medication, all those kind of things. The fact that they're selling it over the counter, that means Nabil, MEOR, and whoever else can just buy it and share it across, isn't it?
It can be shared, provided that you know yourself, you know that you are not allergic towards that medicine.
Okay.
That is our concern lah. So for over-the-counter medicine, it's very simple treatment. You can share it if you know the exact dose. For example, paracetamol, you have to know the maximum dose of paracetamol per day.
Yeah.
What is the maximum dose? 8 tablets.
Okay. You had a fright just now.
In gram.
No. 8 tablets a day throughout every 4 hours, isn't it?
Every 4 hours.
I mean, like two tablets every 4 hours.
2 tablets every
4 to 6.
You have to know 1 tablet how many milligram.
Okay, it's 500 usually.
Yeah, kalau 1 tablet 500, and then 2
See the
tablet.
calculator in here is coming out already.
Yeah.
I'm calculating right now. So actually the maximum is 4 gram per day. So for 1 tablet with 500 milligram, the maximum you can take is 4 times a day.
4 times a day.
Not 4 hourly.
Okay. 4 times a day.
Maybe sometimes people do not know the consequences of sharing medicines. Maybe you can share to us what are the worst cases that could occur.
Worst case scenario.
Yeah, worst case scenario. Is there any real life cases that you can remember?
Real life
that happened to someone who has shared medicine?
Yeah, sharing medications across, maybe perhaps.
Okay. For life cases, I do not really have experience. But as you mentioned earlier, that your sister have allergy towards paracetamol, and then paracetamol is a very common medicines, right? And we think that that is the safest medicine for all, but it turns out your sister is allergic towards it, and can lead to harm because allergic reaction is very dangerous. It can also lead to death. Okay, so for real life case,
or maybe something you've heard from your mentors or from your previous colleagues. Nothing much. Nothing much. But again, it is not advisable for anybody outside there to actually share. Again, as what we have been discussing throughout this morning. But ultimately, if paracetamol and cough medicine is dangerous to share, let alone any specific kind of medications like for hypertension, for diabetes, that's even a big no-no, isn't it?
Yeah, correct.
But it's expensive outside to buy it.
That's why
I'm putting my PT face here right now.
That's why you can take it for free from the KKM, from the Klinik Kesihatan. We give it for free.
Okay.
Yes. So that's why we, for patients who are under treatment, from with the Klinik Kesihatan or from the hospital, we pharmacy, we will always give them what do we call it, TCA, to come again.
TCA, okay, we're not medical students, so we cannot answer you.
Appointment date, yes.
Appointment date,
Appointment date to collect the medicine. So sometimes there are patients, they think that, alamak, ubat dah habis, and then pinjam jiran. They pinjam jiran. It is very dangerous because we do not know whether the medicine, the hypertension, even though there are 2 individuals having the same disease like hypertension, but the disease, the treatment that doctor has been given to the individual
is
actually
personalized,
it's individualized. So it is very dangerous lah if they want to share the hypertension medicine or the diabetes medicine.
If someone, let's say a sibling in my family, people in my household share the same medicine with me, and then feel that that person is having some allergic reactions, I mean, what should that person do? What would be your advice if they have
an allergic reaction,
a negative
or
reaction
something, a negative reaction towards
a medicine?
the shared medicine?
Just straight away go to the hospital, because for allergic reaction is very serious. You have to go and seek treatment for that. Okay, because we don't want the anaphylactic shock to happen. Because that is life-threatening.
Your throat can close up, and like it is a very scary thought, because again, these are the kind of things, honestly, that none of us actually think very seriously, because again, we always think that medicine A is applicable for everyone out there, but ultimately, as what you have mentioned, it is quite personalized in regards of each treatments and whatnot. And it's something that a lot of people need to be aware of. So what would your message be to our audience, Ms. ELIFA, in regards of, you know, this habit of sharing, because sharing is always caring, isn't it?
Right. I guess not in this case.
I don't know. I mean, like, it's up to her. What do you have to say about this? What would your message be to our
Even
fellow
though sharing is caring, but not for this case lah. So medicine is individualized. So remember not to share your medicine unless you are very sure about it. But for me, I strongly advise to not share your medicine lah among your children, among your family member or your friends. Okay. So for patients who need to obtain, okay, this is like an iklan sikit.
Okay. Sure.
For patients who need to obtain their medicine, for Ministry of Health already provide services, value-added service, such as medicines by post, medicines delivered by third party, drive-through pharmacy, park and take pharmacy, and also medicines local service. So for this kind of services, you can, for those who are under treatment with your own facility, you can ask from your own facility and try to get the service.
So no excuses for all of you out there to not be able to actually get your medication. Right? Awesome stuff. Thank you so much to our local resident pharmacist, NURUL ELIFA Muhammad Zaini T from Tanglin Health Clinic, Kuala Lumpur. I love it when she literally looked to the eyes of our audience. Thank you so much for your kind and wisdom sharing session
Thank
for
you so
today.
much,
Thank you.